So I'm from Cross Plains, but I went to school at Wisconsin Heights, so the Black Earth Mazomanie area. And that's where my husband's from as well. We're high school sweethearts. So I have a 3-year-old daughter and a 1-year-old son. My daughter is my glitter and glam, always likes to dress up, and my son is just everything cars and trucks, crashing into things and just very go, go, go. Yeah, I'd say my number one thing that we do is family time, spending time with the kids and my husband, and then we really incorporated fostering their grandparents' relationship with my kids. So we're on a weekly basis at least going to spending time with our folks and a lot of our siblings. I'm a knitter and a painter. Those are my two big crafts that I like to do, but anything and everything. I really like making things, and I love doing that with my kids. So painting with my kids and making things, I think that they get a lot of enjoyment out of it, and then I get something to give to the grandparents and put on our fridge, which is great. My mom was a big influence. She was a neuro ICU nurse, and I always looked up to her with all of her medical knowledge. And then my love of science kind of led me into the path of medicine. So I've always wanted to practice in a rural setting, live in a rural setting. I was in the rural training track through both medical school and through residency. So I feel like I've been fortunate that my training has targeted me to be able to practice in a rural area. I grew up in a rural community, a small high school, and it's just kind of some of my roots that I really wanted to stay to give back to a community similar to what I grew up in. My philosophy is that my patient is a person. It's important to know that every time a person comes into the office that they have their own preferences, their own values, beliefs, their own limitations, as well as their own support systems. And so what's right for one person certainly is not right for everybody. And so I feel like it's my job to try to work with each patient as a person and what's going to fit best with their life, to help them really try to become their healthiest self in what way that works best for them. There's a lot of things that's very rewarding about being a physician. It's really hard to pick just one. I would say one of the most day-to-day rewarding things is delivering babies. It's kind of one of the most it's a miraculous thing to be there when you bring life into the world, and it's definitely a privilege to be able to be involved in that. The other thing that I think is really rewarding is the relationships that you form with patients and the continuity that family medicine offers. So I really like being able to treat, the kids, the parents, the grandparents, and treating the whole family.